SARC Talk. SARC is a nonprofit cancer research organization that develops and manages clinical research trials in pediatric and adult sarcomas. SARC Talk is a podcast to discuss activities of SARC, interview sarcoma research leaders, and review scientific initiatives in the sarcoma field.
Welcome to SARC Talk, episode number 30. My name is Scott Okuno. I'm medical oncologist at Mayo Clinic and Chief Medical Officer of SARC. At SARC Talk, we interview interesting people who are connected to sarcoma, where we can all share and spread the knowledge about sarcoma. Today, our guests are Dr. Conrad Chappie, as well as Mitch Achee and Dr. Mitch Achee, and our topic today is the Sarcoma Directory from SARC. Dr. Ernest Chappie, Conrad III, is actually recently retired as professor and director of orthopedic oncology at the Department of Surgery at the what we would say the McGovern Medical School at the University of Texas Health Science Center in Houston. Part of that time, Dr. Conrad did founded the adult and pediatric sarcoma clinics at the University of Washington and the Seattle Children's Hospital, where he spent most of his career. He also founded the Sarcoma Foundation Alliance as well, and during his tenure there, did bring a lot of great opportunities to the Washington state area, as well as his expertise to us at SARC as well. Dr. Conrad has been our SARC board president and recently rotated off. So thank you, Dr. Conrad, for that. And he continues to serve in multiple aspects at SARC, and we'll hear about his efforts that he's quite passionate about. Andy and Mitch Achee are members of the SARC RAC, which is called the Research Advocacy Council. They also run in the National Leiomyosarcoma Foundation. Annie helps run the Sarcoma Coalition, and Dr. Achee is a retired radiologist and a member of multiple, in fact, they both are members of multiple patient advocacy groups across the sarcoma spectrum, as well as the cooperative groups, and they'll be happy to share more information about that. They are both tirelessly committed to their support of sarcoma patients and their family, and it's a great opportunity to have all three of you here today to talk about the SARC Sarcoma Directory, but more importantly, kind of important that we say is how do we all engage with a patient advocacy group and the importance of the Sarcoma Directory for our patients and our families. So with that, maybe for all of us here today, since I know all of you, maybe others online know as well, but it'd be great to kind of share each of you how you all got interested in sarcoma. And maybe we'll start with you, Chappie.
Sure. I entered the sarcoma world as my first rotation in orthopedics. That's at the Sloan Kettering Orthopedic Sarcoma Service in the early 80s, 1981. Was very impressed with the new sort of building and multidisciplinary team, the surgical challenges, the challenges of pediatric osteosarcoma, which was undergoing revolution with new improved survival results with their adjuvant chemotherapy, and developed my passion also for systemic therapy in that same experience. To my regret, it's taken us adults have a much bigger challenge with their sarcomas than we've had with regards to the track record for osteosarcoma for kids. But that was my introduction.
Yeah. You know, it's funny. Here is an orthopedic surgeon who is so ensconced into the importance of systemic control of the sarcomas, and it's been great and refreshing to see that. So it's great. Annie, maybe you can share with our group how you got interested in sarcoma.
Well, as a caregiver to my husband, to Dr. Mitch, I became involved in 2011 when he was diagnosed. And as a caregiver, it was very daunting and frightening because I didn't know how to pronounce or spell the particular sarcoma subtype that he had. And so I was reaching out to anyone and everyone in the sarcoma realm, but I really didn't get the support that I thought I would be getting. So when I had the opportunity in 2015 to actually try to lead the National Leiomyosarcoma Foundation. I really felt the deep need to do that because I wanted patients to go through a much easier uh, support experience. And so since 2015, we've really launched many, many programs in anticipation of the patient needs and to meet their unmet needs. And so I'm very honored to be part of this podcast today with SARC because I feel that Dr. Conrad has worked tirelessly, as has the whole team with you and everyone on his team to really bring the directory to a wonderful launch that's going to help us to help the patients all together. There's nothing like collaboration in all of this.
Yeah. As we say, collaboration is in our name for SARC as well. So this is a great thing. Thank you, Annie. Mitch?
Well, as Annie said, I wasn't expecting to be in the sarcoma space, but in 2011, I was diagnosed with a leiomyosarcoma, had surgery, and then 6 courses of chemotherapy. And during that time, Annie and I were, looking for information about the disease and where to be best treated and stuff like that. And so I was fortunate enough to get to one of the sarcoma centers of excellence. And I think that's one of the reasons I'm a 14-year survivor now. I've been very blessed to have gone through that. So I think the directory is going to be a fantastic resource for patients and their families to make sure, hopefully, they can get the best care as early as possible and the best care possible.
Perfect. Annie and Mitch, you both have been running the National Leiomyosarcoma together since 2015, and we know the importance of getting access to care at sarcoma centers, and that's part of the reason why we're having this podcast as well, is to ensure that our SARC Sarcoma Directory does suit the needs. Maybe you can share with our group here a little bit more of the history behind the National Leiomyosarcoma Foundation and what projects you're working on and how you all are connecting with our present SARC directory.
The foundation actually began very informally in 1997 by a caregiver in honor of his wife who had been diagnosed with leiomyosarcoma. And so they had informal gatherings with patients and families because the families were such a loss as to what to do because they couldn't pronounce it or spell it either. And so then in 2001, they incorporated into the foundation. And in 2002, they started to fund research. And so from there, it just continued to evolve. And then we started in 2012, rather than having patients come to certain sites, having to get in an airplane and travel, we thought maybe it's best if we meet the patients where they are, come to their sarcoma centers of excellence and see their own oncology care team, their multidisciplinary care team in a different light by them presenting pertinent subjects that they'd be interested in getting updates on, like surgery, treatment options, radiation therapy updates, certainly clinical trial updates, and integrated medicine, how to keep themselves uh, in check with their well-being and emotionally and physically. And they were very interested in that, especially nutrition during treatment and after treatment. And of course, the survivorship care planning process after treatment was completed. So it's been wonderful programs that we've set up and they've been very well received. We've been to about 17 sites now, but then when COVID came, we sort of had to curtail that and pivot to virtual meetings. And now we have both virtual and on site, and we're very glad for that. And it really helps the patients who can't travel even to their own sarcoma center. So we've launched so many programs to try to address the needs, the unmet needs of patients as we talk to them all over the world. We've talked to people from Qatar to Brazil to UK to Australia, everywhere. And so we really realize that everyone pretty much has the similar experiences and similar needs. And so that's what we feel is our best patient advocacy role is to meet their needs and meet them where they are in their treatment journey. And we've launched an international research roundtable that brings global research community, the physician scientists together so that they can talk to each other and spark collaboration and move research farther and faster through this process, and thereby accelerating uh, treatment options ultimately through the clinical trials that evolve from the research collaboration that comes from the roundtable.
Yeah.
And this year we'll be in Berlin for a second consensus paper on the unmet needs of patients and caregivers. So it's going to be a wonderful meeting this year. But we're in our 7th year, so it's been a successful initiative that we launched.
Very
Plus,
good.
we support the research, the young researchers, to continue to replenish the pipeline of the very talented researchers that we already have had for so many years and have been blessed with. And we have the Early Career Award, and we're in our 2nd year of that. Dr. Denu from MD Anderson received our 2nd award this year from MD Anderson. And we also launched our Early Career Faculty Recognition Award. And that'll be the final nomination of that will be coming up soon. But we also fund a lot of research for the young investigators, and we're very proud of that, to be supporting their research efforts. And we just
So,
appreciate all the
yeah,
dedication and commitment that the research community has on our behalf. And we feel like we're contributing to any research for any sarcoma subtype. We feel that whatever we try to do at the International Roundtable can speak in the future to any sarcoma subtype.
absolutely. Well, there's a lot of things that you have shared that you guys are doing and continue to do, and all the great success to that. And maybe, Mitch, you can share a little bit of how you make sure patients, or how do patients that happen to come through your door get connected with the SARC Sarcoma Directory?
Sure. Yeah. Well, the new directory is coming out, but we had a directory in the past, and it's always the important thing we always stress to patients is you need to be seen or at least consult with a sarcoma center of excellence, people that treat these diseases regularly, to get the best care as soon as possible, even before treatment, and preferably, if you could, before surgery, if you're diagnosed by imaging or something that could do that. But we've always felt that the SARC directory was the best resource for people. It's divided by states, and so people can find a center close to themselves. It has always been a great asset. So we always tell people it's on our website as a link, has been for forever. And but we also tell them to find the center, and if we're talking to them, we'll tell them what centers might be close, and they can get more information on the directory. And also, that it's very important for pathology to have an accurate pathology report, since sarcomas are often misdiagnosed initially, and that information is usually will be available on the directory as well. And that can be done, virtually, and your slides can be sent in if you can't get to a center, and have it reviewed by a pathologist so that we get an accurate diagnosis that can focus the treatment on the subtype that you have, since there's so many subtypes of sarcoma.
Absolutely. So it sounds like there is a big push to get to known, reputable sarcoma centers with high volume. And I know, Chappie, you've worked hard as a major driver of ensuring that healthcare providers, sarcoma providers, engage with advocacy groups. And you've worked very hard when you were at Washington, as well as down at Houston, as well as SARC pushing us all the time, Chappie, on this part too. And maybe you can share with our audience how patient advocacy groups at SARC work together to help drive sarcoma excellence.
Well, I think I'm definitely a big believer in advocacy. Initially, because of I started my program also in the 1990s, 1994. It was actually a gift from a young family, Lisa and Ron McCleary, from the eastern Washington farmlands, and she had a bad sarcoma, got poor treatment, and died pretty quickly. And they had decided they were going to give a gift to start a sarcoma foundation so that other patients would be more aware of what a sarcoma was, and other primary care people. So that was my first deep experience, and deep and long, many years of monthly calls. I think the advocacy people and SARC are natural partners. That you see that in the medical and scientific advisories of most of the advocacy groups have a lot of SARC colleagues, and I think there is a natural relationship between the two because we share goals. We share the goals of sarcoma awareness. We share the goals of trying to simplify referrals to expert centers, and the goals of education for the patients and the families and primary care people. This new directory that we are developing now strengthens the relationship between us and our advocacy people. I'm hoping and expecting, because we expect our advocacy partners, who are all in our minds sort of honorary members of SARC, and we expect them to really carry out most of the details of patient triage, despite the fact that we now have a more functional referral system within the new directory. I still think the main source and support for our patients is from disease specific and regional sarcoma advocacy groups, because they are specific on the diagnosis. They were pretty tough on us when we started the accreditation, and I'll give you a story about that later on. But I think it's a wonderful relationship, and I'm expecting it absolutely to be strengthened with our advocacy partners with this new program.
Absolutely. So maybe in that vein, Chappie, maybe you can describe how our old centers were developed, and then more importantly, what have been the needs. And maybe Annie and Mitch, you can also fill in the gap as what has been the additional desires of the sarcoma directory that we didn't have originally that's made us now go to the next level. Maybe, Chappie, why don't you start?
Sure. So SARC started in 2005 at a British meeting at Royal Marsden in London, where basically an academic sarcoma group that wanted to emphasize the support and the management of specific sarcoma trials, with many of these sarcoma centers, which were mostly academic groups. That at that time they created an online map that was a pretty popular map for sort of where to go for your sarcoma clinic if you lived in, especially if you lived in a low population area, and like this, some of the states with low populations. And that creation was very functional for 20 years. So I came along in my naivete and said, we haven't looked at this program in 20 years. We need to look at it to see if we can't make some improvements and improve the communications with our membership programs. And that was at least 2 or 3 years ago. So in 2024, we did a reaccreditation process for all the people that were on our maps. And we asked for a voluntary questionnaire to be filled out that confirmed that they had a multidisciplinary faculty, that they had multidisciplinary conferences, and that they had a certain volume, what their estimate of their volume of patients was. And we had our patient advocacy partners that were already involved with SARC, which included Annie and Mitch, to be involved in that process. Those partners, we learned in that process that those partners were very focused on diagnosis specific disease for obvious reasons, because the better advocacy groups were diagnosis specific or regional groups. And so they were very set on the fact that we needed to begin to develop a better database of how many of these subtypes are occurring in various population areas, and who are the experts. They were very passionate about sort of having a list of experts that was sarcoma specific. So we responded to that in a little bit of a different way, but that was the biggest challenge we'd met in the beginning of that reaccreditation. The reaccreditation then sort of finished at the end of 2024. We started to build a directory. We wanted a directory that would include sort of a sarcoma encyclopedia. I took the WHO document, which has an impressive legacy of diagnostic classifications for soft tissue and bone tumors, and I simplified that and used it for the purposes of our online patient education. And then on top of that directory, we had specific diagnosis specific referrals. The directory contained 10 chapters. It was about 150 pages of just soft tissue. It had 80 diagnoses in it. And each chapter and each diagnosis had specific referrals that were diagnostic specific for sarcoma centers, for patient advocacy, and for clinical trials. I even built a new sarcoma advocacy directory that I'm heavily revising now that had more than 120 institutions in it from the beginning. And I missed a bunch of people that we're adding on now with their kind connections and contacts. So the entire system was built to improve referrals to both centers and to advocacy and to clinical trials. And we, near the end of the design process, we added a helpline to offer information. And that directory now is entering its final editions or revisions with the help of Dr. Kuno and my steering committee. And it's a much better document now than it was several months ago. It was a 6-month process. And we're very excited about we're expecting to make that directory and that online program to go live on July 1st in honor of Sarcoma Awareness Month. And that was the development process and the historical record of how we got involved with that.
It's great always to stop and reflect. The original goals of our map served its purpose. However, there's an evolving need. And Chappie, you kind of said that there's a need for reference guide, as you said, access to clinical trial helpline, but there also is the connection to the patient advocacy groups as well as histology or tumor specific information. And maybe Mitch and Annie, you can share with our group, how has that been impacting your website? Because I went and checked your website again right before over the weekend just to make sure I knew what the content that you had there. But also then it's also important is how does your site connect with the information that is on the SARC directory and the importance of having a SARC directory with histology specific information and expertise, because that's a big deal. And that took Chappie and the team a year and a half to do it. That's a lot of time. So Annie and Mitch?
Well, our website has changed as well. We refreshed it, but it's still evolving with trying to refresh information and update it. So our website reflects what we've seen and talked to with regard to patient needs. They seem to be very concerned with financial toxicity once they're diagnosed, and especially if they're in a clinical trial. The financial toxicity has been really difficult for them. The emotional stress, anxiety of dealing with the disease, managing the symptoms, and trying to survive. And maybe they don't realize that they are survivors from the time of diagnosis. They think they're not going to survive. They say, well, don't say I'm a survivor because I don't know if I'm going to make it. And we always stress the fact that the clinicians, the researchers, we all feel that you're a survivor in trying to get through the diagnosis and the treatment. So that's what our website, we anticipate the needs. We have survivorship, clinic information. We have a list of all the survivorship clinics of the sarcoma centers that offer that. We have clinical trial links to all the sarcoma centers so that a patient can go straight to the sarcoma center that they're being treated at, for instance, and they can see, they can find the updated list of clinical trials for their particular sarcoma subtype. In our case, it's LMS. So we try to do that. We offer links to the UK, to the European clinical trials as well. And so we want them to have an easy way to navigate the information that they're seeking. And certainly that's what the directory mirrors as well. And we're very proud to have the SARC directory listed in our website, because it's all about supporting each other. And when we first started with SARC, it was a support and mentorship experience, and now it has evolved into a real collaborative spirit of support and moving things forward for the sake of the patient.
And I'd like to add, I think an important part of the new directory is several years ago, as part of the Sarcoma Coalition, I volunteered to look at the existing lists of sarcoma centers in different foundations, and also looked at the SARCs. And after my review, it was the best of all of the four that I looked at. By far, that was the old one. The current one, and one of the biggest problems was, as I went through those sites, which I think Dr. Conrad has done and his team, is you have to have a phone number that works. And I would say a large percentage of the phone numbers did not go to where the patient needed to go to get the best and quickest result. And I think that's very important in this directory, that we have really good, and they've worked very diligently to make that the case, that you get to the sarcoma center if possible, or as quickly to the sarcoma center to get an appointment as you can. And I think that's a big advancement as well. It was a major issue when I did the review of how few were actually accurate.
And the real highlights of the directory have been wonderful. The matching of the clinical trials, the expert helpline of support, and the reference guide. It's all just, it's a real win for the patient and caregiver community.
So Mitch, when you click on the teardrop icon for a center, it gives you a summary sheet, a basic summary about the center, and it also gives you contact information that's supposedly all been theoretically updated. So we'll see if people still have any problems. I think that big problem has been mostly resolved.
I think so.
So, as you know, we're very fortunate to have more and more people in more and more centers across the United States and the world that have developed expertise or enough volume to say they meet the bar for what we would say is have enough volume multidisciplinary clinics to say this is a referral center. However, as you know, many of our colleagues do move. They do retire. They do transfer. So it's very hard for us to keep up with that. So as Chappie said, SARC is trying to develop the infrastructure just to keep up with the contact names that have been there for 10, 20 years. So we have to make sure those links do work.
And I think it's important to note, too, that this directory is not only for the United States. It does have centers, as the team has worked very hard to do throughout the world. And I think that's important as well, because we do get a lot of people contacting these different foundations from all around the world.
Absolutely. That's well said. You know, the effort, as Chappie said, is that this directory will not only, show where the SARC centers are with certain volumes, multidisciplinary clinics, but they're also going to add reference material or information. And that's a huge amount of work because this field information is changing every single day. And it is hard to keep up. And as Chappie said, he wants this to be a living document. I think that's the hard part, is how do you keep it living with new information every single day? So with that, we have the SARC Center that's going to go with a new directory, new links coming up in July. We're going to have a reference guide. But Chappie, you also brought up the concept of a 24-hour hotline. And I know that's something that Mitch and Annie do provide similar type of things. And maybe you can share with our group what is your vision of that 24 hotline, and then maybe also what the Mitch and Annie's group does as well. Chappie?
Well, initially, I just wanted it to back up the directory in case people, as you get older, you're not so facile with navigating computer programs, and I wanted it to be available for people that were struggling with the drop-down menus, et cetera, that's involved with our registry. And also, I wanted them, if they wanted just to ask for advice on a consult service, I wanted that to be. I've been managing a line with you together, Scott, for the last year, and I'd say half the calls are international online, and half of them are online American calls for either a second opinion. Most of them have been on relapse disease, interestingly enough. Some new patients, but I'd say 2/3 of it is on relapse disease. And this is going to be a document, the directory, that we're going to have to monitor and see with the activity of it on and revise it accordingly. I'm going to add references to it, annotated references on some of the more controversial points, which are the bulletins where we recommend not to delay your diagnosis, etc. I'm very into expanding the international part of the program because of all the opportunities there. Actually, I had a dream that I stole Dr. Okuno and took him to Vietnam so that he would establish a Mayo Clinic sarcoma clinic in Vietnam.
There you go.
But I got in trouble for that, so it wasn't a nightmare; it was a dream.
It's a dream.
One of my wishes. International,
Yeah.
lots of opportunities. They're more interested in subtypes than your average American oncology person, and we have gotten a lot of signups in the last 6 months from both American and a lot of international groups that are now becoming more aware of SARC. For various reasons. So. That's the plans for the future. We're going to continue recruitments. The biggest change in this directory is that, and I'm embarrassed to say that I didn't focus on this in the beginning. My buddy Seth Pollack, who's on the steering committee, along with Bree Wilkie and Nita Samaya and Angela Hong, in addition to you two, Mitch and Annie, and Jeff Kramer, a couple of really high-profile advocacy people, and a new board partner that's a pretty exciting new partner, and a new nursing partner. And that steering committee has done a lot of really, really helpful things. They've only been around. We only appointed them at Scott's suggestion in February and March. But they have been enormously helpful with the recredentialing questionnaire, the subtype issues, and also with the final edition of the directory. But the two things that they contributed most of all was this directory is for patients. SARC is for patients. It makes no difference whether your sarcoma clinic, your excellent sarcoma clinic, is in SARC or not in SARC. We still want you on the map. We want it to be a map for all excellent sarcoma programs. And that was one aha that we got mostly from them. In addition to what was the other? Oh yeah, the pushing us. How could I forget this? And the two of you were pretty good at this, pushing us down the sarcoma highway on giving you, and the SpringWorks people were very opinionated on this, that they wanted a list of desmoid doctors. They didn't want a list of clinics. Well, we didn't do that because my steering committee didn't agree with that, actually. We did, however, now classify these centers by volumes, and it's impressive to see what the volumes are on some of these centers. I'd say our top 6 or 8 or 10 programs see well over 1,000, if not 2,000 sarcoma patients a year. And the high volume mark that we decided on in the end was that large volume centers would be defined with a population of greater than 250 new patients in a year. And that the other thing, in my opinion, that defines expertise. So I think the larger, more developed centers clearly see more of the ultra rare subtypes and the rare subtypes, just simply because they're seeing so many sarcoma patients, number one. And number two, it's all about clinical trials. Dr. Kuno has done an incredible job of picking up business and design and the development with his multiple layers of second lieutenants, clinical trials. And I think the number of clinical trials that an organization, again, usually the bigger organizations, can do, they, like if they've just finished doing a trial on clear, or in the middle of doing a trial on clear cell sarcoma, they're clearly going to be one of the experts for clear cell sarcoma. So when you're focusing for the real upper crust excellence, which are, the upper third of SARC, it's going to be about volumes greater than 250, and the clinical trials that most of those groups are nurturing and supporting and carrying out on a yearly basis almost. So those two
Absolutely.
issues completely came out of my steering committee, with their assistance on advice and Scott's supervision.
Well, it's interesting because the original SARC directory was giving people an awareness of where sarcoma centers are and where SARC trials are. So that was a different focus. So I do think, you did name SpringWorks, but I do think a lot of other groups are really looking at subspecialty expertise. If you have a tumor that's
Yeah.
only 200 to 300 across the United States, you're more likely to get expertise if you go to a high volume center. And then, as Mitch and Annie know, they run the Leiomyosarcoma Research Foundation, and they've pulled together specific researchers who design trials for leiomyosarcoma. Josh Subner and the Chordoma Foundation have researchers that do chordoma. The Desmoid Research Foundation, DTRF, also has researchers who just want to do that. And then you also got Jeff Kramer, who's doing the chondrosarcoma part, who just want to do research. So those boards are really pushing hard to drive, where does expertise reside in the research realm, but clinical expertise resides at the centers that have high enough volume. And I think that is the important part. It's the tug and pull,
It is.
because and it's an awareness that SARC has to evolve for the needs that are going out there, but also not give up that, hey, there might be good clinical expertise of how to manage chondrosarcoma, even though you're not actively doing the basic science in chondrosarcoma. And I'm just throwing that out there. So I think, Mitch and Annie, do you have any other insight into the histology specific parts? Because you're living this with what you do in your organization as well.
Well, we try to help the sarcoma subtypes that don't have patient advocates organizations behind them. So we've been helping PICOMA and LIPO, and I know not LIPO now has an advocacy group, but undifferentiated pleomorphic sarcoma. We try to help all of them. We're all in this together, so it really doesn't matter what sarcoma subtype patient might call us for help, but it's just all about how to get them the information they're seeking quickly because they need it immediately. And
Annie,
we're also big on second opinions too, so
yeah,
Yeah.
we push that hard too.
one of the most common sarcoma subtypes is UPS, undifferentiated. And because of my own pet peeve about pathology, we started a UPS project that Boston Genes has sponsored with really generous in-kind donations on molecular profiles. And I've got 5 very, very sharp mid-career pathologists from SARC who are now working on a diagnostic roadmap project that I think will eventually somehow combine with Scott's multidisciplinary tumor board, because these pathologies are our gatekeeper. Maybe we're making the wrong diagnosis in some of our clinical trials because the molecular side of that, like Scott said, is changing by every year or two from many of these subtypes. And some of the pathology stuff. I'm involved a little bit with a project with a new AI program that takes the WHO document and reassesses your last 500 pathology reports on accuracy. And that's seemed to have 90% accuracy in the initial pilot. And those pathology groups are a great opportunity for participation with our pathologists and with the smaller organizations. And I think we're going to have to see with Scott's intelligence how we combine those groups with all the pathology devotees currently involved with the SARC's tumor board, which is a really great program. I felt so strongly about that when it started. I made a personal donation to support the first year cost of that program, and that's a program that's going to slowly become very formidable.
One other comment I'd
Absolutely.
like to make about the directory is the original directory had some, one of the major complaints was pediatrics. And I think your team has done a tremendous job, and because some centers had pediatrics in both, but it was not really that clear. But I think the new directory really improves that. And I think that's a big plus for what your team has done, is to identify those centers that do have pediatric expertise.
Yeah,
Absolutely. And
I have a huge pediatric interest. I started the program at Seattle Children's. I was one of my Boston colleagues and I were the first people to do both orthopedic oncology and pediatric oncology. And I would love for us to get a larger footprint, at least in the AYA world, for future trials. But right now, we've got our hands full with Scott's pipeline of 5 or 10 trials in the next 2 years.
yeah. So as we're looking at the various support that we do provide, SARC, as Dr. Conrad saying, is trying to work to be more patient facing, provide more of a helpline. Maybe Mitch and Annie, you kind of highlight a little bit is how do you engage the patient and what advice are you helping patients navigate through?
Mitch, do you want to start
Yeah.
that?
Well, I guess, like I said, we get many patients from around the world calling us and with different questions. We always what we always stress is we don't give treatment, recommendations per se. What we say is, my first question is, where are you being seen? Have you gotten a consultation if you're being seen in a community by an expert? Who looked at your pathology? I asked if you had genomic testing of your tumor. And those are the questions. And then we try to guide the patient, give them information, and then say, you should consider this, or this may be a clinical trial that would apply to you. We don't know, but ask your doctor. It's always ask your doctor. Is this something that's appropriate for you? And so I think that's what we try to center on, is giving them whatever. And as Andy said, financial toxicity is a big issue. So we have a listing of organizations that can help people in different aspects of that. And so I think that's what we do is, and we're always there for them. They have any questions and try to guide them in the right directions. That's our purpose.
Are there financial programs that'll help sarcoma patients? I mean, are there more than one or two?
Well, so far I've listed 23 currently. I just did
Wow.
that last week.
Wow.
And so when they call, even we've had the American Cancer Society refer patients to us from all kind of cancers because they're really looking for that resource assistance. And I always give them my list. And it could be prostate cancer or pancreatic cancer. I'm there to help anybody, but because that's what we need to do.
Can you send me your list, Annie? Because I have a couple of people internationally in South Africa and stuff, Cape Town, and needed help with paying for a drug or something.
Okay. Now I haven't gotten to that far as international. These are all just within the U.S.
Yeah.
And I'm not even sure about Canada.
Yeah.
So I'm still working on it now because I'm still working on the website. But we just feel that whatever we could do through our chat line or through our newsletters too. We do newsletters every 2 weeks, and in between the newsletters, we do a sarcoma sound bites. If we see some research that they should know about and want to use it as a talking point for their appointment with their sarcoma specialist, then that's what we're hoping that they do. So, and then well-being tips for getting through. So it's a one-page soundbite in between our newsletters. We used to do our newsletters every week, and then finally we've cut back to every 2 weeks. And so we just hope that they read it. We hope that they get a lot out of it so that they can generate questions in their mind as talking points and be their own best advocate is what we always stress.
It's amazing. Here we are all together, and we're learning more information, even though we've all connected multiple times, that there's actually additional resources that may be available that you guys have at the National Myosarcoma Foundation. I know, Annie, you're part of the Sarcoma Coalition, so you're trying to get the word out to all the sarcoma patient advocacy groups as well. And we just have to make sure our website or the SARC Sarcoma Directory also has those links as well. So this is great.
Well, Dr. Akuno, I appreciate that you're our advisory panel member for the coalition. And we hope to hear from you about the Sarcoma Tumor Board and the directory, especially in July when it's Sarcoma Awareness Month, because we have 36 organizations under the umbrella of the coalition, and they need to hear what you all do and how important you are to them to be as strong advocates through knowing more about what you offer and the collaborative spirit that can be further developed besides what we have here together with our foundation.
I like
We're
that idea too. And to that
grateful.
point, as you know, Annie and the team are trying to make sure that we are committed. And as we said from the very beginning, part of our name is collaborative. And Chappie's been working hard to engage as many people as possible so we don't trip over each other. You know, there's enough work that could be done across, and that's the collaboration that we want, and that our new Sarcoma Directory will fit a niche. That's going to be very, very helpful. You did bring up the steering group, Chappie. This steering group is up and running now. We're going to have the go live for our new directory, hopefully on July 1st, 2025. How will people be able to interact and provide input as this site gets up and going?
There's a SARC web address there for them to respond to. They can do it through the directory, through the helpline part of the directory, and just ask questions through the helpline through that email. And
Perfect.
those get screened by our SARC team, and then I respond to most of them personally.
Perfect. So as you get, it's not a one-time deal, static endpoint. It's going to be a constant, living, evolving program that's going to hopefully serve the needs of our patients. As this airs, this will be coming out probably sometime in July. And July is Sarcoma Awareness Month, and that's come up a couple times today as well. And we're really excited about that. And as you know, many of our organizations do celebrate, many of our states do celebrate Sarcoma Awareness Month. So with that, maybe we can ask each of you as we come to a close here, is that if you had one opportunity to put something on a billboard for July about sarcoma, what would that be? And maybe we'll start with Dr. Conrad. What would that billboard say for sarcoma awareness?
See an expert and don't delay your diagnosis.
Love it. See an expert and don't delay. That's what the billboard's going to say. Annie, how about you?
Stay in the game of health and research for rare cancer, sarcoma, July Awareness Month.
Stay in it. Is that what you're saying, Annie? Stay in it. Stay in the game. Love it. Mitch, how about you?
Well, I think those were great suggestions. Mine, I think, would go back to we had a project before in the coalition called the Golf Ball Project, and I think I might actually Jeff Kramer came up with this idea. I think I might say, address the ball, have a lump, have it evaluated.
I love it. In fact, Chappie and I have been commenting about, what is the size of a golf ball? You actually have to know the size of a golf ball, and we get into that and to that point. So I'm excited
what is it, about 4.62?
4.54 centimeters exactly. Some odd number, but it's correct. But the concept, as we all know, is that most lumps are nothing, but some lumps need to be looked at, and the urgency and what needs to be looked at would be your billboard. Get it evaluated, right, Mitch?
Right.
I still look at that twice a week, Mitch. I love the more generic, keep your eye on the ball, because then it can be It could be
Yeah.
a golf ball. It could be a baseball. Some of these
Right.
kids had rhabdos that are 2 centimeters big. So it's a tough.
Well, that's actually better. Probably keep the eye on the ball. That's a good one. I like that.
Yeah. Anyway.
Well, remember, the billboard's already made. You can't now go and change. No, I'm just, you can do what you need to do. So
There's
once
Wipeout. There's Wipeout on
that is why that's correct. So, first of all, thank you three for being here with us today to talk about your passion about sarcoma, passion about getting information out to our patients, and also providing the care and support they need during their cancer journey. So we do appreciate that. And this is not a one-time deal for each of you. You know, you've been engaged in a sarcoma community for some period of time. So we're very grateful for your support, and not only support of your organizations, but also of SARC. I know Mitch and Andy, you spent tireless time with us, with our Research Advocacy Council, and supporting other events that SARC has done as well, and we do appreciate that, and it does not go unnoticed. So thank you.
Scott, same issues to you, Scott. It's impossible to exaggerate the role you played at SARC with recovering us from the dark period that we were in, and your leadership with the medical and clinical trials part of the business has been enormous. Thank you so much for all your hard work.
Well, thank you all, and it's been a fun opportunity. And all organizations are trying to continue to improve, and that's really what we're hoping, that our organization at SARC continues to improve. And we look forward to what you all see with our new SARC Sarcoma Directory in July 1st. Are there any other final comments from either of you all before we part?
Well, we're honored and grateful to be able to have the opportunity to stand with you. You all are the tall trees in this difficult forest of sarcoma, and to shed light and be a guiding light for all sarcoma is really something very special. And I wish the patients could see what you do on a daily basis and really understand that you have their backs. We all have their backs, and they're not alone in this. That's the main thing. They're not alone in trying to get through this.
And kudos to
And
you, Annie and
we're very
Mitch.
grateful for this.
But thanks so much for your support for SARC.
Yeah. Well, we appreciate it too. I mean, it's Dr. Conrad is theoretically retired, but he took on this monumentous project, and both of you, the time and effort that you spent to make this directory the best, not only this but the other SARC projects as well. And I think the patients, I want to say on behalf of all the patients and their families, thank you for what you all do. It's very, very important. And the directory is going to be a great resource for patients as soon as it comes out and for years to come.
I spent half of my life on the fine line between courage and stupidity, and directory is a little suggestive of that same effort.
So for all those that are listening, we appreciate the time and effort that you guys are here. And I'll end with what Annie said. You're not alone. We're in it together. So thank you all. Looking forward to a great July and sarcoma awareness, and hopefully you'll all benefit from our SARC Sarcoma Directory. So thank you all.
Thank you for listening. Be sure to subscribe so you never miss an episode of SARC Talk. To find out more about SARC, please visit our website at sarctrials.org. To suggest a topic or for questions, please email us at sarctalk@sarctrials.org. Together, we can find a cure for all forms of sarcoma.